watching us. We are delighted to have you tuned in Church of Uganda Family TV on this Tuesday. The month is almost ending. When we say it's almost ending, someone was saying we are now on the 70th day of the 100 days of January. But nevertheless, we want to thank the Almighty God for the life He has given us. We want to thank Him for the protection. And above all, we want to thank Him for the gift of salvation. And of course, the fact that you can smile, the fact that you can listen to this voice, the fact that you can see this image, that should be enough for you to say, thank you, Lord. It doesn't matter what you've achieved today or what has failed out. Yeah, the fact that you have life, we are grateful to the Almighty for the life He has given us. Today is a Tuesday, and of course, on our family, our menu, Tuesday is health. Today we are looking at we are looking at our children, little sisters, little brothers, who are going back to school. And we want to make sure that we prepare them very, very well as they go to school. Because one of the issues that disturb children at school is actually oral issues. Oral issues are another thing to children that go to school, partly because of maybe the things they're exposed to, and that is why we want to speak to you as a parent, but also sit with your child as you watch this program, because some of the information that's going to be shared cuts across. So you shall be speaking to the parent, what you need to do as a parent, but also to you as a child, at whichever level you are, whether you're primary or secondary or university. Please sit and listen through, because what we are yet to unveil is for you. Today we are looking at essential oral health tips that we can adopt to safeguard our oral health. And with us is Nabaasa Nafutari. It's a pleasure having you.
Okay, thank you, Mr. Idris. It's a pleasure to be here again.
Good evening.
Good evening to you.
Where have you been hiding? It's been a while. Well, I don't know when we last had you here.
Obviously, I've been there trying to preach oral health to Ugandans.
Okay.
Yes, and I'm calling upon our viewers tonight to be ready so that they can share and be part of our conversation.
Sure.
They will learn a lot so that they can really improve their oral health. But not forgetting to thank the management of Family TV for always giving us the opportunity to do this, to try to give back to the community. Yes.
That is interesting, and of course that is why we are here. We are here to enrich lives and to give people content that they can trust. Getting into our discussion today,
yes.
Let us begin with oral health as oral health, because I've looked at some medical forms, school medical forms, where they request parents to take children for oral checkups, but I think that is not enough. Probably they can check and they're okay at the time of checking, but then they get issues on the way. So I think the tips are more important, and the oral health gospel, spreading it out to the people out there. But oral health as oral health, in a sense, what is oral health?
So now oral health deals with the entire mouth.
Okay.
The oral cavity, whatever is in the mouth, not just merely our teeth. When we talk about the structures found in the mouth, or what we call the oral cavity, the sum of them all is what comes to be oral health. Those include the tongue, the teeth, the gums, the throat, everything that is found in the mouth. That is what sums up to be oral health. Taking care of everything that is found in the mouth. That is oral health.
Okay. So meaning today we are looking at the entire. But what is the most delicate of all the parts in the
Of course, when you talk about oral health, eventually what comes in everyone's mind, of course, they are the teeth.
Yes.
Yeah, they think it's some of the essential part that is found in our mouth.
Okay.
Yes, so obviously we are here to discuss about some of the tips, essential tips,
Yes,
for both the parents and then the school-going children.
Yes.
What should they do? What are those key points they should put in mind as the children are reporting back to school? What should the children themselves do, and then what should the parents do? You know,
what the parents should pack for their children as they're going to school.
Obviously.
Okay.
That's what we are here to discuss tonight.
Sure. And I think we get into the essential tips. First of all, we start with what parents should do before they send their children back to school. Because
ideally, parents should act what they preach.
Yes,
they should be practicing what they preach. It is very bad for a parent to be advising their children on a certain maybe practice when they themselves are not doing it. You know, when we are still young, we always copy from our parents.
Exactly.
So ideally, for example, if we are saying that one of the measures of avoiding these common dental problems or teeth problems is maybe flossing. You know flossing? And the child has never seen the mother or the father flossing. They don't take that advice of your.
They only see them with toothpicks to try to.
You see? So there's no way we shall advise or we shall tell a parent to buy flosses for their children when they have not been using them. So this time around,
they don't even know how they look like.
We are going to advise the parents to first practice what they preach their children. Yes.
And we start with that. Because I realize that parents really have a lot of things to do when it gets to preparing this child before they go to school. And then later we shall get to the children themselves. And if you're a parent watching on behalf of your child, so that you know what exactly and how exactly to help them or guide them while you prepare them to go to school.
First of all, this has been a very long holidays where it involved Christmas and you know what. So, of course, we assume our children have been eating whatever they could come along with, you know. So we need to, first of all, alert our parents outside there. Why is it important to maintain these milk teeth? Milk teeth are also called the baby teeth. Of course, when we are talking about children in dentistry or as far as our teeth are concerned, a child begins from 6 months of age, you know, up to 12. Those are the children, because those people will be having milk teeth. But obviously, as we are talking about school-going people or school-going children, it also involves people or some children with permanent dentition or permanent teeth. So we are going to obviously to be making points that cut across, that are favoring both the children or the underage and then those ones who are above maybe 18 and plus. So first of all, parents should put in mind that milk teeth are very vital. Milk teeth should be taken care of. Milk teeth or the primary teeth should be taken care of. You know, most parents tend to ignore or neglect the oral health of their children. Just simply they assume these are milk teeth. After all, they want all come out, you know. I will start taking these people to the dentist when they develop permanent teeth. You find they are themselves, the parents are acting as dentists at home. They are trying to manage or to, you know, to cater for the oral health of their children, which is very bad.
Following the advice given by elders.
They are trying to get any piece of thread to pluck out their children's teeth, which is very bad, you know. So tonight we are here, of course, to alert you how to maintain the oral health of your children. First of all, you need to appreciate that these milk teeth are the ones which maintain space for the underlying counterparts, for the underlying permanent teeth. You know?
In other words, they're paving a way.
Yes, they are paving a way. Meaning that if the child starts suffering or having decayed milk teeth, they are going to suffer oral health for some good time. But if we put in mind that these milk teeth should be taken care of in the earlier stages, then you are going to, of course, make something like good oral health. It's going to be nice for the rest of their lives. We should also put in mind that these teeth can, of course, they eat, you know. So a child who will not be having a good oral health or who are going to be having issues with their teeth, they are going to be missing some kind of meals. You know, they are going to be feeling, you know, low in the community. They are not going to be confident when they are at school. They are going to be laughed at. You know, someone is having, you know, gaps, maribu, at a young age. So this is very embarrassing when it comes to what? To children, of course, to when they're in their community at school. You know, I remember there is one parent who brought their children at my facility. They had, of course, malaligned teeth. And, you know, the best medication for this malalignment is when we align them with braces. But now this parent was insisting, no, I need you to remove these teeth, these malaligned teeth, because they are my child is feeling very low, very less confident. She's being laughed at school. So, and I don't have money maybe to do this. So remove them so that she feels very confident, you know. So those are some of, you know, the points that our parents outside there should put in mind. They should not be relying on their information.
Let me ask you a question before we even go further. Is there a possibility that a child can remove the milk teeth and then they don't get the permanent teeth grow?
No, it's impossible. Maybe if they went to traditional dentists. Traditional dentists, have you ever had them?
Abakule ebinyo.
Abo. Wagenda yo, maybe they remove, you know, beneath or under a primary tooth, we always have the underlying one, you know, the permanent, the bud or the cells of a permanent tooth. So if you accidentally remove them, meaning this person is going to do what? To miss a permanent tooth in the long run.
Okay.
Yes. So obviously, I was trying to talk about that it has been a long holiday. We assume that children have now gotten, of course, you know, the problems with their teeth. For example, like the cavities, their teeth are now dirty. You know, those children, the common practices like thumb sucking, nail biting. So we assume that every parent outside there should, first of all, this is tip number 1, you should have taken your children to a nearby dentist for a checkup. That is point number 1. You know, really, it is very hard for a parent who has never had a checkup to take their children for checkups.
Because for us to know each time we come to the dentist, so we are going to remove the teeth.
Really, you should not wait for pain to take your children for dental checkups. Every parent outside there, at least many schools have not yet started. They have not yet resumed. We advise you to take your children for dental checkups. Let the dentist detect these problems at earlier stages. They are going to provide a solution when it is still early. It is going to at least be costly for you. You see? That is point number 1. Checkup. Checkup to detect problems when it is still early. Then in that checkup, a dentist is going to maybe to clean the child's teeth. You know, if your children has maybe dirty teeth, let them be cleaned. Of course, as a parent, you also need to do your own checkup. You see this child, like you can examine them in a mirror or anywhere. If you just start seeing anything like spots or cavities in your children's teeth, go take them to the dentist. Let them be taken care of. We can apply some small sealants or what you call cements. Yes, when the cavities have not yet deepened. Then, if your child maybe is in that stage of removing teeth or extracting teeth, those ones which are shedding, let them be removed. You know, when a child really reaches at the age of 6 years, it is at that stage that many of them start shedding, or the milk teeth start shedding, paving a way for the permanent ones. So if your child in that stage, of course, you need to take them to the dentist so that they can try to spot which teeth are shaking so that they can be removed. Delay in removing those teeth, of course, will cause malalignment. It will make the underlying permanent teeth grow on the other side of the gum. You see? Yes. Then, of course, we know that some of the students or some of the children are already on treatment. They are already on treatment. Maybe it can be root canals or orthodontic treatment, or they are on braces. So when they report back to school, of course, we advise parents that you should give this child a medical form so that they can always give them some space or give them some permission to go and, you know, finish their dental treatments. Because most of our dental treatments, we don't just complete them in a single visit. So you find that a child is in a strict school and they cannot allow him or her to do what? To move out, which will, of course, fail our treatments. Those are some of the tips, obviously, that the parents should take care of.
Okay. There is also another habit that parents use at home. For example, if a child has some bleeding gums, they tell them, you use ash or you use salt or use... Are these first aid remedies? Are these remedies as now for you dentists? Are these things you really advise parents to guide their children with while trying to eliminate such problems?
Of course, those ones are called myths and misconceptions about our teeth, or as far as dentistry is concerned. We don't advise parents or either children to use ash, to use charcoal, to use those sticks as a way, of course, of trying to fix them in our teeth. Rather, we advise, but what is the use of us as dentistry is concerned? I really don't know, and I haven't.
It makes your teeth shine, so that when someone looks at it,
it's like shining. I used to hear people say, when you want to visit a dentist, you don't need to eat anything, so that it becomes very easy for him to practice or to remove your tooth. Really, it is a miss, because our tooth is really embedded within the jawbone. So removing it has nothing to do with ash or, yes. Then charcoal, that is a miss. Charcoal doesn't bring anything like brightening of your teeth.
Because what they say about charcoal is that because this charcoal is got from different trees, some of those trees are herbs that can be used, that can be having some solutions that can help to treat your teeth.
I have no idea about that. I have no idea.
That is what I've had someone explain.
To us, it is a myth, so I don't want to explain something that I'm not sure of. But as far as dentistry is concerned, we don't advise anyone to use charcoal. Yes. Then back to our parents, of course, we advise, as your child is reporting back to school, on top of that list that you want, list of items that you want to buy, include flosses, dental flosses. Let your child know that brushing is not enough. On top of brushing, they should also be frothing their teeth to remove, of course, those food particles that are in between. Those debris are not going to come out on their own. And those are the leading cause of almost all the dental problems. Yes, brushing is not enough. We should also involve flossing. Even if we are to brush, buy like 2 to 3 toothbrushes. Don't just buy one, because you're going to buy one toothbrush. A child is going to reach at school. You know how we misplace things when we are at school. Is going to start sharing another toothbrush with their friends, which is very bad and can easily be a way of spreading of micro or germs in the mouth. Yes.
I look at a situation where, for example, some people are in places that are so remote that maybe they see a dentist once a week at a government health facility. There are no private clinics with dentists, or else they'll see a dentist once a month, yet they have this child who has a dental issue. Is there any first aid that you people advise, you dentists advise, that can be taken on as they wait for the visit of a dentist? Or probably someone has an issue at around 7 when maybe you've closed the facility, and so they have to wait up to tomorrow at around 8 a.m. So should they keep the pain till tomorrow morning, or their first aid?
Of course, there are always first aid measures. As we know that at least in every village, or at least the 2 neighboring villages, we assume that there is at least a drug shop. If it is not a clinic, there is a drug shop. And these drug shops or clinics have always had the first line of painkillers. At least we assume that there is a painkiller this child will take to curb or to stop the pain until when they meet either a dentist or a clinic officer. Because at those health center falls or health center cities, they are clinical officers. And yes, the dentists are not common in Uganda or in those remote areas, but these clinical officers, they have been equipped with some skills, at least of removing or extracting people's teeth. You think who removes people's teeth in villages? Dentists are fully occupied here in Kampala, and it is the clinical officers who are doing these things. They are performing our roles in villages. Because of course there are even some people who never went to school, who have never practiced dentistry, but they are in the villages removing people's teeth,
and they have mastered that art.
And people are happy with them. So that child who, of course, is suffering from that kind of pain, we advise them to always visit the nearby drug shop. They will always be provided with painkillers that will stop the pain, because dental pain is seriously ill. It can bring headache and obviously the whole body.
At what level should someone give up on their teeth and say now remove it? Is that the best solution in moments of pain? For example, I have a toothache, my cheek is protruding and all that. Is that the best solution you can offer? Because people have actually tagged you as abakuzi b'amanyi, and that is all they think the dentists do.
Mr. Idris, to answer your question properly, I will take you to the topic called indications and contraindications of extraction or removing teeth. When should we remove our tooth? When are we not supposed to remove it? Even if it is thick, when should the dentist remove a tooth? Or when for example,
because these are things people don't know. For them, they think each time you see a dentist, and actually some advise them, okay, we shall remove yours at 2 p.m. Keep around, and people think this is the only remedy available.
Now, there are some people, of course, who wait until when the cavity deepens and you find the whole tooth is eaten up.
Ugandan spirit.
The whole tooth is eaten up completely. You know, our tooth majorly compromise is made up of two parts. That is the crown, the crown, the outer part, you know, and then the root. You cannot see the root. The root, of course, is embedded within the jaw. You see? So when the whole crown is eaten up and just the pieces of the roots which are remaining, and they are also decayed, that tooth cannot be saved. You see? Two, when your tooth is completely fractured, maybe you involved in a nasty accident, like children who are involved in falls, you know, and you know the 3/4 of a tooth are broken or completely fractured, that one will call for removal. Or when even a person has a painful tooth, but they cannot afford other measures. Maybe the dentist has advised that this tooth, yes, it is painful, but we can save it. We can do a root canal. How much is the root canal? 200,000. I cannot afford it, sir.
But I have a 5,000 for extraction.
We shall not leave you in pain. We shall discuss all the possible treatment plans for your painful tooth. What you afford is what we do. For us, we first advise the best treatment plans, and what you afford or what you tell us to do is obviously is what we do. You see? So if a person now tells you, know, dentist, I liked your advice, I really also wanted to opt for that one, but you know, I'm financially unstable, I can't afford, but of course I'm in pain. What will you do? Eventually this person will lose a tooth. But it's not a must that we shall do what maybe. We always, it's not the dentist's role to be removing teeth. No. We also don't enjoy when we are removing people's teeth, because removing your tooth actually is like becoming lame. Yeah. It's like an abnormality. It's like just going to visit a medical doctor and you're complaining of maybe a swollen hand or any issue or an injury on your hand, and you're saying, you know, doctor, chop off my hand.
The pain is too much.
The pain is too much, so chop off my leg, chop off my hand. So removing a tooth is very bad. You just assume that every time you have a toothache, you're losing a tooth, you're losing a tooth, you're losing a tooth. I always tell people that, you know, in this world, we are struggling hard to be good, you know, to have money and, you know, have a bright future. But how would you have a bright future? How would you enjoy the money that you're struggling?
When your mouth is not bright.
What would you, because at least in this world we live without any. So at least what you pick, you eat it and you feel comfort. No, you're not having this. What would you use?
There is also a tendency now that we are speaking to. We are in a back to school last season, where children get oral issues at school, and then they are told to call their parents. So a parent says, don't send that child back home. Let me send the money so that they can go and the tooth be removed. And of course, this is something parents find ease in. But what are some of the challenges of removing your teeth?
Of course, just like there are a lot of disadvantages of losing your tooth, Mr. Idris. One, if you lose your tooth, just like I told you, you're going to have a problem with your jaws. Do you know that it is our teeth that hold or make us have like a good smile? So if you don't have teeth, you'll make these muscles shrink. You see? Of course, you're you're looking ugly. Two, if you lose your teeth, have you ever seen someone who doesn't have teeth, how they speak? Assuming you don't have any tooth in your mouth, you have, every time you get a toothache, you say remove.
You can hardly listen to the words.
Speech difficulties, of course. Speech problems. You not be speaking. You know how they speak. They don't pronounce some words properly.
Yeah.
They will not be eating some food, of course. If you lose it,
they call a thumb.
Most of, if you lose the molars, the posterior teeth or the behind teeth, you will not be able to eat certain foods like meat. You see? So you will start forcing. Miss Iris, it is very bad to lose your tooth, by the way. Speech difficulties, eating disorders, you just be swallowing food without chewing them, of which is also very bad. You see? Of course, shape, aesthetics, your outlook is going to be very bad. More so when it comes to ladies. Yeah, losing teeth is something bad, and you shouldn't advise anyone.
Even men, these days men want to look good. So just imagine you can't have your cheeks here.
So it is very bad to lose your tooth. That is, so we call upon, or we advise anyone to always opt for some good treatment plans or good measures of saving our teeth than just opting for removal. And how do we do that? By doing routine dental checkups. Go and visit your dentist so that they can detect the problems when it is still early. When they detect a problem at an early age or at an early stage, it is going to be cheap for you to afford. Yes.
Now we are taking a short commercial break. When we return, we are now going to talk to you, the children, and the parents. What should you consider while you pack for your child whatever you want to buy for them? What should you eliminate? What should you forego? What should you include? Those things, because children will always give you all their endless lists. But as a parent, there is also a need for you to pay attention to what they need and what is good for their health generally. We are taking a short commercial break. When we return, we shall pick it up from there.
This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
Welcome back from that commercial break. This is Family Hour, empowering families one episode at a time. Adrian Austin Mokalas is my name, and of course today we are looking at oral health tips, especially for school-going children. And with us is a dentist, Nabaasa Nafutari, NN. But before the break, we actually looked at a lot of things. Now, we know that parents do a lot of things out of love, yet some of these things are the cause of the oral issues that their children get in turn. What are some of the should I call them bad habits, that parents should advise their children to avoid?
Yeah, thank you, Mr. Eddie, for that question. Of course, as a parent, you should, of course, pay attention to your child and watch for these bad habits, bad oral habits. You know, these are common oral habits in children. So as they are going back to school, watch them. And we shall see how, of course, to manage some of them. One is thumb sucking. You know, most children, of course, from 2 years of age up to like 4 to 6, they always suck their thumb.
I think it starts even way earlier, because some parents actually introduce their children to that because they think when a child sucks their thumb, then they don't cry a lot.
No, that's a miss, of course. Thumb sucking is a practice where children are sucking, are licking their thumb. Why do you think some of them suck it? It is because it provides that kind of sense of safety, you know. They feel comfortable when they are sucking their thumb. Some feel neglected, and they see that kind of sucking thumb as a way of feeling that kind of... They find a comfort zone in sucking their thumb, and then safety. Maybe when they are neglected, when they are in that fearful conditions. Those are some of the reasons why these children go ahead to do what? To suck their thumb. Of course, some do it as a habit. But of course, as a parent, you should be supportive in avoiding this practice. Being supportive, of course, I'm trying to mean don't beat this child because they are sucking their thumb. Try to teach them or to advise them some of the disadvantages of sucking their thumb. Because thumb sucking, more so at the areas, you know, at the early ages, it will now try to make the front teeth, more so the upper front teeth, to protrude. It tends to exert that force on these upper front teeth. So in the due case, of course, the child's teeth are going to be malaligned. You see? So of course, that thumb we assume that it is not clean. So it also might introduce those microorganisms or the germs in the mouth. But as far as dentistry is concerned, this thumb sucking will majorly affect both the upper front teeth and then the jaw. It would cause that kind of a change in bite or a change in the way how someone occludes or they bite. So it will cause that kind of an abnormality. We call it an overbite. Yeah, so it is very bad. And as a parent, of course, you should go and talk to your dentist. They will see a way of advising or of helping your child, whether to make for you an appliance. Yes, to put, to advise this child some of course, you tell them about the disadvantages. You are likely to have malaligned teeth, you are likely to be roughed at, so stop sucking your thumb at an early age. Second, nail biting. Of course, some of the children outside there, not even just young, even the adults, you'll find them biting their nails at a young age. Of course, as a way of feeling maybe confident. Some feel like biting their nails is a way of gaining that kind of comfortability, which is, of course, very bad. So those practices are very bad, and as a parent, watch them. If you see that your child is biting their nails, of course, biting nails can also cause some fractures or breaking of those teeth or the front teeth, upper or lower. Yeah, they can break because children's teeth are not all that hard. So if your child is really biting their nails, advise them, teach them, advise them accordingly, and let them stop this practice. You might not stop it as a parent, but if you involve a dentist, these things are going to be okay. Because the dentist will try to give that extra advice. You see? And it is going to be okay. So that is going to be nail biting, thumb sucking, nail biting, and you see, we can also talk about chewing ice. Some children, even at my own home, whenever we put some sodas or any drinks in the fridge, you'll find them running for those ice, those condensed ice, and those ice are very bad. So most on our teeth. They cause that kind of breakage of the enamel. When you talk about ice, is it also taking along ice cream? Ice cream? Of course, I'm meaning these very, very cold substances. But the cubes. Yes. You're talking about the cubes. The ice tubes. They are those, you'll find when they are completely ice. The solid ones. Yes, the solid ice. So it is very bad. And children buy them. I think some shops sell 100. So you find that children leaking. They are not good, obviously. They can cause injuries to their teeth. They are very hard, but a child will go ahead to break it with their teeth. So it might cause fracture, causing sensitivities and other healthy problems to our teeth. So we should always stop it. Because by advising them, when we are dealing with children, you're not going to stop a habit on that very day. It is a process of stopping this, to break this habit. It is a process. You'd not just wake up on one day and stop a child from maybe thumb sucking. No, it is a process. You need to know when do they suck their thumb. Which scenarios? Is that wrong rides? Is it when they are watching movies? Is it when they are sleeping? So you will now know how to deal with it when you know the exact time when they like to thumb suck or to do that bad oral habit. Yes. Then, of course, our children outside there, they like sugary food products. Anything to do with sugar, you will kill them. So as a parent, when your children are reporting back to school, ensure to remove these sugary food products. At least if you're buying, limit. We can just say limit or regulate, because a parent will not stop buying them. But at least you regulate, you reduce. You see, because if not that, of course, it's going to be affecting your children's teeth. Those are some of the poor oral habits that affect our children. While we were at school, they used to tell us brush every after meal, and then some others are told brush 3 times a day. And then, it is a little funny that to some children, for example, day scholars, for people in boarding, it might be hard. It might be easy because maybe you access your dormitories or hostels at some point. But this day scholar who leaves home in the morning and goes back in the evening might not be able to brush maybe their teeth 3 times a day or things like that. So what are some of the best practices to protect our teeth from oral issues? Boarders or day scholars? Both. So one, ensuring our oral hygiene. Yes, by brushing, of course. Brushing is the least method. Like, we are meaning something that is not expensive, less costly. If you brush properly, if you know when to brush and you know the right technique to use, then you will have provided a good remedy for your teeth. You have people who use sticks. No, sticks are not good. We condemn with brushing. We don't advise anyone to use sticks. Some people think that those sticks, some people think that chewing gum is an alternative to brushing. We have always heard and people complaining about those things, but it is not good to use any other thing and you compare it to do what? To brushing, because we are brushing to remove food debris that are in our teeth, that are in behind teeth, that are in between our teeth. You see, we are brushing to remove those coatings on our tongue. So how do you tell me this tree or chewing gum will serve all this purpose? So one, we advise good oral hygiene, maybe through brushing. Secondly, we advise flossing. If you're a child, if you are maybe a university student, go buy flosses. You can find them in a supermarket. You can find them in a pharmacy. Go buy dental flosses. It is always a pack.
Yeah.
Hey.
And the pack goes for about 5,000.
5,000 only. But it serves a good purpose. Go and buy flosses.
There are very many in the
There
pack.
are very many in a pack. Go buy them and always floss your teeth. Morning, afternoon, anytime you feel like you want to floss. That is, of course, flossing. Then another
So
thing,
can flossing replace brushing?
it is not, because even brushing.
No, I look at a situation where, for example, I brushed in the morning, but I have my lunch and I have nowhere to brush from. Can flossing replace the brushing at lunchtime?
At least after rinsing, of course, we always advise people to brush very early after breakfast, not before, but after breakfast, so that we can now remove these food debris that have collected during the eating of breakfast. So after you brush, now you've gone to school or for classes, you see. During that time, let's assume the dormitories are closed. Even if you rinse, just rinse, you have removed these food debris before they harden. Maybe if you have a dental floss, if you moved with a dental floss, you can utilize it at that time. You can floss. You will have removed these food debris that are in between our teeth. So that when you now go back to class or after evening supper, you see, you can rinse, you can brush again before you go to bed. Of course, we advise people to brush very early in the morning after breakfast and late evening after supper. Of course, so during that time, you can always use dental flosses. However, these dental flosses, it should not be reused. You should use it and then throw it away. Some people have a tendency of, using it or sharing it. You see? They think now, this dental flosses, how can I access it? So now, if a student A sees where a student B is maybe keeping it, or a friend, then I saw a dentist advising floss, and one of my friends has them. You see, they will start now stealing them. So parents should pack these things to their children, because these are affordable things, and they are very vital as far as our oral health is concerned. So we are advising about the measures, how, of course, to solve some of the dental problems.
It's still about oral hygiene. We still have children that have bleeding gums. So each time they brush, some even forego brushing. Each time they brush, the gums are bleeding, and so they feel maybe it is this toothbrush that is scratching the gum to bleed. So how do you advise on that?
Of course, many children outside there don't know how to brush their teeth. They don't know how to brush their teeth. They just think that grasping a toothbrush, of course, and putting a toothpaste, they now start scrubbing the mouth.
Roughly.
Scrubbing their teeth roughly. First of all, scrubbing your teeth roughly can cause abrasion. You're removing those the outer layers of a tooth. Scrubbing your teeth can remove those outer layers. Of course, it is over time. You will not remove them in one spot of brushing. No, it is over time. So aggressive brushing is very bad. It will, of course, cause abrasion or the removing of those outer layers of your teeth. It will also cause injuries on your gums. So aggressive brushing is very bad. And when your gums are of course, harmed, they are going to be infected. You see? So, of course, we always advise people to go ahead and, clean their teeth. Cleaning or scaling. Most people will always see these coated yellow, browns, substances or the stains on their teeth, and maybe they think, I need whitening. You see? Kumbe, it's just stains, dirt, or uchafu. So parents outside there should first take their children to the nearby dentist for cleaning, because those stains are going to cause bad breath, Yes, they are going to cause bad breath. They are going to be the leading causes of cavities in our mouth. So parents should, first of all, do it so that their children can know. If you have been a parent who is cooperative with dentists, if you have been maybe visiting dentists, Mr. Idris, there is something we call dental anxiety. If a parent outside there doesn't visit dentists or is not used to dentists, there's no way their children will also get used to them. Actually, they will be fearing them. they will be fearing them to an extent that just a child entering a dental clinic for the first time, they always cry. They have never been in a dental clinic, but the first time they are entering, they are always crying. So really, it is very, very bad for children not to get used to dentists. It causes anxiety, and when a child is anxious about our treatments, even if they have a toothache, even if they have any dental problem, they will not let their parents know. Yes,
True.
they are going to endure the pain because they know, every time I tell my parent, visiting a dentist now,
Yeah.
you see? So it is really very bad. We advise parents to always take their children to dental clinics, even when they don't have any issue, to get them used to
Familiarize with the dentist.
Yes.
Okay.
That thing is very, very good, actually.
Okay. So you were still talking about bleeding gums, and then you said sometimes it is caused by the way students brush, but there is also, this is a very common thing in schools especially. At what point should someone change their toothbrush?
Okay, so of course, as children are reporting back to school, we advise parents, like I told you at first, should buy for them at least 3 to 4 toothbrushes, so that if one gets lost, they now replace it immediately. Obviously, the standard time of how we should be changing our toothbrushes is 3 months.
That is almost a term.
Yes, that's a term. But,
that's a term.
But of course, we know that our children, more so the nursery, the school-going children, the kindergarteners, the way they mispress these materials is on a high rate. So we advise parents.
Not even nursery, even people in secondary, even in high school. You know, we recall the days when we were still in school, how students would dump their toothbrushes in the bathrooms and what.
You see, where you could actually find them on the floor of the bathroom. So as a parent, buy 3 to 4 toothbrushes for your child, so that in case they mispress one, they should not be sharing the toothbrush with their friends. Okay. Then, as in for these kindergartens, you can maybe buy like 3 to 4 and go give them to the matron. Let the matron take care of the child. Tell the matron to teach your child how to brush, because these kindergarten children, that is the underage, they don't know how to brush their teeth, which is the leading cause of dental caries and other diseases in the mouth. So if these matrons, actually, those are some of the measures dentists and oral health schools Uganda is putting in place. Training teachers, training students at school, training these workers, the maids at home or even at school, how to nurture and take care of children's teeth. Because if you're a parent outside there and you're not concerned about your maid's oral health, yet it is this maid who is spending almost all the time with your child, what are you thinking about? Every time you buy sweets, they are sharing it. Yeah. They are sharing the same cup. These people are always laughing, and you know what? Saliva can eventually spread, and that's infection crossing. So mind about the oral health of your maid. You have also prevented, dental diseases for your child. That is a good point.
And lastly, how should these toothbrushes be kept?
Of course, keeping our toothbrushes, toothbrushes majorly for our children, they always have a lid. You see?
Those are expensive ones. There are a parent who goes for one of 1,000, or I hear there's one of 500.
But do you know that we have electric toothbrushes? Only that when we are trying to talk about toothbrushes, we always talk about the ordinary ones. But we have different types. Okay. Yes, we have electric toothbrushes, we have traveler's toothbrushes, we have tree-made toothbrushes, and then these ordinary ones. So it depends on which type of toothbrush you're using.
Let's look at the common.
The keys that manage each and everything. Really, you can see that you're not minding about your oral health. There are some containers, small containers, where I keep mine, by the way. You can also find them. Simple container, improvise, because we are not going to say that there isn't any material that is meant to keep your toothbrush. Yes, but you can improvise and see a way of keeping them in a clean, conducive environment. Okay. Yes.
Thank you so much, and kindly give us your closing remarks as we wind up with this discussion.
So, again, In my closing remarks, I first thank the management of Family TV for always giving us the opportunity to teach or to let the nation know what is bothering them as far as oral health is concerned. And our today's topic has been how parents should take care of their children's teeth as they are coming close to the reporting dates of their school. And, parents should, first of all, what they should put in mind, or the big point here, or major point in our discussion, was routine dental checkup. When you take your children for a checkup, it is where a dentist will detect each and everything that is in their mouth. We have spoken a lot, but this is the major issue: routine dental checkup. Let these children be aware of their oral health before they report back to school. There's nothing else. Routine dental checkup is the key, both for parents and then their children. Schools, when they are opening, we always go for checkups. We check each and every student before they enter. Yes, to let the schools know that a number of students, this number has gotten dental caries. These ones need to clean their teeth. These ones, so because really, a child with a poor oral health, a child with a painful tooth will not concentrate at school, meaning that you have wasted your school fees. There is no parents outside there who wants poor performances from their children. So oral health can be a threat if we don't do dental checkups very early.
Thank you so much, and thank you so much to you, our viewer. It's been a pleasure having you from wherever we started up to now. My take home is, we shall share it, you and I. When did you last visit a dentist? Now, when you answer that question, it will summarize all that we have been discussing here. So if in the whole of last year you never had we have people who have spent almost 5 years without visiting a dentist, and then you take pride in that. For me, I mean, please, prevention is better than cure. Visit a dentist and just have that checkup for your teeth. Now do it to your children as well before you take them to school. Please take them for a dental checkup. It might not only dental checkup, but take them for a general checkup, so that you can know the status of your children before they go to school, so that you're not shocked when you are given this phone call from school. Thank you so much once again. Edwin Austin Mukalazi is my name. I've worked with Didmas and Jonah Jal, and from the entire team, we wish you a blessed